Are you feeling constantly tired, lacking energy, or even experiencing that annoying tingling sensation in your hands and feet? What if I told you that these symptoms could be linked to a deficiency of just one vitamin? No, we're not talking about the famous B12. Today, we're going to explore vitamin B1, also known as thiamine, one of the most important vitamins for our health, yet often overlooked. This essential vitamin plays a crucial role in the functioning of our nerves, brain, and heart. Surprisingly, many people aren't getting enough of it. If you're curious about what can lead to a vitamin B1 deficiency and the symptoms that come with it, stick around until the end of this video to learn all the details. Before we begin, don't forget to like this video, subscribe to the channel, and hit the notification bell so you won't miss more life-saving content like this. Are your feet feeling like they're burning or tingling? What part of the world are you from? Drop a comment below so we can get to know each other better. Which vitamin can cure neuropathy and nerve damage? Vitamin B1, or thiamine, is crucial for converting carbohydrates into ATP, the energy source for cells, especially in the nervous system. Without it, fatigue and tiredness can occur. Beyond energy production, B1 protects nerve cells, preventing issues like neuropathic pain and memory loss. It also supports heart health, ensuring efficient blood pumping. Deficiency can weaken the heart, causing symptoms like shortness of breath and swelling. Ensuring enough vitamin B1 intake is essential for both nervous system and heart health. What causes vitamin B1 deficiency? Excessive alcohol consumption. Alcohol interferes with the absorption and increases the elimination of vitamin B1, leaving the body in a state of deficiency. This problem is common among alcoholics, but can also occur in those who regularly consume alcoholic beverages, even in moderate amounts, like daily wine consumption. Diet based on white rice. One of the most well-known historical causes of B1 deficiency is the excessive consumption of polished white rice, which loses most of its thiamine during processing. In the late 19th century, a Dutch scientist noticed that beriberi, a common disease in Java, also affected chickens. He discovered that brown, unpolished rice contained an essential anti-beriberi factor, which was later identified as thiamine. Consuming large quantities of white rice can lead to a deficiency in this vitamin. Processed foods and nutrient-poor diets. Foods like white bread, refined pasta, and other ultra-processed items are low in thiamine. During the processing of these foods, vitamin B1 is removed, leading to a cycle where excessive consumption of processed foods results in a greater loss of this vitamin in the body. Health conditions. Diabetes. People with diabetes excrete higher amounts of B1 through urine. Use of diuretics. Medications like furosemide, Lasix, hydrochlorothiazide, and indapamide increase the excretion of vitamin B1. Dialysis. Patients undergoing dialysis also lose thiamine at an accelerated rate. Conditions that increase your need for thiamine, like hyperthyroidism. Excessive tea and coffee consumption. Beverages like tea and coffee contain enzymes called thiaminases, which destroy vitamin B1. Excessive daily consumption of these drinks can contribute to deficiency. Raw fish and sulfites. Foods like raw fish contain thiaminases that degrade vitamin B1. Additionally, sulfites present in foods like wine and dried fruits can also interfere with thiamine absorption. Intestinal surgeries. People who have undergone surgeries like bariatric procedures, e.g., gastric bypass, are at greater risk of B1 deficiency. These surgeries alter the intestinal pathway, reducing the absorption of essential nutrients like thiamine. The reduction of the stomach size can also limit the intake of B1-rich foods. Symptoms of vitamin B1 deficiency: irritability, loss of appetite, and memory issues. The first signs can be subtle and easily overlooked, but they indicate that something is off with the vitamin balance in the body. Nerve pain, neuropathy. Intense pain that runs through the arms or legs caused by the direct impact of B1 deficiency on the nerves. Tremors. Involuntary movements, such as shaking hands or other body parts, can occur due to a lack of this vitamin. Anxiety and feeling overwhelmed. Low B1 levels reduce cellular energy in the brain, leading to constant anxiety, irritability, and difficulty managing stress. Depression. B1 deficiency affects neurotransmitters like serotonin and dopamine, impairing mood and contributing to symptoms of depression and pessimism. Lack of focus and concentration. Difficulty in maintaining attention or completing tasks can indicate that the brain is struggling with low energy levels caused by B1 deficiency. Trouble sleeping. Difficulty relaxing and sleeping with a constantly active mind can be a result of B1 deficiency, which helps to slow down brain activity. Restless leg syndrome and lactic acid buildup. The feeling of needing to move your legs when sleeping or waking up is often associated with lactic acid buildup due to B1 deficiency. Burning sensation in feet and hands. Numbness, tingling, or a burning sensation in the extremities are signs of peripheral nerve damage caused by a lack of thiamine. Dizziness and vision problems. B1 deficiency can affect the optic nerve, resulting in blurred vision, dizziness, or vertigo, especially in people with diabetes. Thiamine, vitamin B1, deficiency and its severe consequences. Thiamine, vitamin B1, deficiency can lead to beriberi, a condition affecting the nervous system, heart, and brain. There are two forms: dry beriberi and wet beriberi. Dry beriberi primarily impacts the nervous system, causing tingling in the toes, burning sensations in the feet, especially at night, leg cramps, and muscle weakness. If untreated, it can lead to muscle wasting in the legs and arms. Wet beriberi affects the cardiovascular system, resulting in an increased heart rate, warm and clammy skin, fluid retention in the legs and lungs, and ultimately, heart failure. Without treatment, wet beriberi can cause dangerously low blood pressure, potentially leading to shock and death. Wernicke's syndrome. Wernicke's syndrome, caused by vitamin B1 deficiency and common in chronic alcoholism, includes symptoms like confusion, eye movement changes, and walking difficulties. If untreated, it can progress to Korsakoff syndrome, causing permanent brain damage, severe memory loss, and chronic confusion. Vitamin B1 supplementation is crucial to prevent these conditions. Before we continue, I've got some exciting news to share. If you want to get more engaged, I'm excited to inform you that we now offer channel membership. As a member, you'll pay a small monthly fee and unlock some amazing perks like early access to new videos, priority replies to your comments, members-only shorts, polls, quizzes, and special emojis and loyalty badges just for you. It's a fantastic way to support the channel and connect with us even more. Just click the join button and let's make this experience even better together. How to diagnose vitamin B1 deficiency. Thiamine. Diagnosing thiamine deficiency involves two main approaches. First, doctors perform a physical examination to look for signs like changes in behavior or difficulty with movement. Second, While direct measurements of thiamine through blood or urine tests aren't reliable, doctors can use an indirect method, measuring trans-ketolase enzyme activity in the blood. Since trans-ketolase requires thiamine to function properly, low enzyme activity typically indicates thiamine deficiency. How to treat vitamin B1 deficiency? The best way to treat thiamine deficiency is through thiamine supplements and adjusting any dietary habits that might have led to the deficiency. You can take thiamine supplements either by mouth or through an injection, depending on what caused the deficiency. If caught early and treated quickly, most symptoms should go away. It's important for folks with thiamine deficiency to keep an eye on their thiamine levels over the long term to make sure the deficiency doesn't come back. How to prevent vitamin B1 deficiency? It's important to maintain a varied diet that includes foods rich in thiamine. Some of the best sources are meats like pork and beef, as well as whole grains such as brown rice and oats. Legumes like beans and lentils, along with seeds, nuts, green vegetables, and brewer's yeast, are also excellent options to ensure adequate intake of thiamine. Additionally, moderating the consumption of tea, coffee, and alcohol is key, as these beverages can interfere with thiamine absorption. Reducing or completely cutting out alcohol can help preserve B1 levels. Special attention should be given to individuals with increased thiamine needs, such as pregnant women, breastfeeding mothers, and diabetics, who should ensure they consume enough of these thiamine-rich foods to meet their elevated demands. As you can see, vitamin B1 deficiency is a serious issue that can significantly impact our quality of life. Did you already know this? Are you experiencing any of the symptoms mentioned? Leave your comment below. If you found this video helpful, please type yes in the comments below. I also encourage you to check out these 2 videos we selected especially for you. Thanks for watching.